Hello, my name is Conica Williams. I'm an LPN to BSN student at Indiana State University. And today, for my Nursing 444 Community Health Nursing course, I will be discussing access to health services in rural areas. The population at risk. According to healthypeople.gov, 1 in 4 Americans do not have a primary care physician, and 1 in 5 Americans do not have health insurance. Residents residing in rural areas are at the greatest risk of not having access to health services. Individuals living in rural areas struggle with utilizing and accessing health care for an array of reasons which will be covered in the subsequent slides. At this time, please take a moment to pause the video and follow the link below to take the pretest. Now that you've completed the pretest, let's take a moment to cover the objectives for this presentation. After viewing this presentation, you will be able to determine why access to health services is important. You will be able to identify characteristics of a vulnerable community. You will also be able to identify barriers to accessing health services. And lastly, you will be able to determine what works for health. Why is access to healthcare important? Access to healthcare is important for an array of reasons, including disease prevention, detection, diagnosis, and treatment of illnesses, improving the quality of life, improving life expectancy, and decreasing the number of preventable deaths. As a community health nurse, it is important to be able to identify characteristics of a vulnerable community. Although there are no definite characteristics associated with communities lacking access to health services, here are some parameters that may be sufficient. For many individuals living in rural areas, if at all present, the hospital serves as the only source of health care. Therefore, lack of access to primary care services is a vulnerability. Another sign of a vulnerable community is a poor economy, which includes but is not limited to high unemployment. Lack of or limited health insurance and decreased knowledge about the benefits of health care is also a characteristic. Lastly, environmental challenges such as lack of areas to exercise, unstable housing, and pollution that may trigger or cause certain ailments. It is also important to be able to identify barriers affecting access to health services in rural areas. Just as it is a sign of a vulnerable community, the increased uninsured rate is also a barrier to accessing health care. Lack of insurance and the next barrier, high cost of care, deter many individuals from seeking preventative care, and typically they stick with seeking services only in emergencies. The previous barriers are characteristically accredited to the increased unemployment rates. Another barrier is the healthcare workforce shortage. Only a meager 10% of physicians choose to practice in rural areas, and leads to the next barrier of lack of subspecialty care, critical care units, or emergency facilities. Lastly, are limited transportation methods. This prevents individuals from traveling to larger cities for care. What works for health? Of course, improving the access to high quality health care will improve overall health, but this cannot occur overnight and may take several years. Some ways of doing this on a shorter term scale is via telemedicine, providing incentives to health professionals currently working in rural areas, or implementing rural training into medical education in an effort to encourage individuals to practice in rural areas. Next is improving the workforce. This can be done by establishing educational programs to improve qualifications, thus increasing the individual's chances of acquiring a career and being able to afford health insurance. Lastly, diet and exercise. It works for your health. Exercise can be addressed by providing an environment that is favorable for, you guessed it, exercise. By improving existing facilities or increasing accessibility to these facilities, individuals will be more inclined to exercise. Establishing farmers markets to get fresh fruits and vegetables encourages a healthier diet. Establishing food banks to combat hunger and provide healthy meals to individuals that are severely impoverished would be a way of improving their health. Collaboration. Why is it important? Collaboration is important to promote health and well-being. As mentioned earlier, improving access to health services in rural areas can take several years. Therefore, the focus is placed on what works for improving health. Implementing programs and strategies takes funding. The community health nurse and her team may have to collaborate with the government to acquire those funds via grants or by other means. Next, collaboration with the community is needed for participation in the program to show effectiveness, as well as volunteering and advocating for your own community by donating time to running the food banks or the farmers market. Lastly, telehealth cannot occur without collaboration. Collaboration with your peers ensures the process and the experience is simple, smooth, and effective. Evidence-based practice. While conducting my research, I came across an article that discussed the use of telehealth as means of combating the decreased access to health services in rural areas, entitled Anywhere to Anywhere: Use of Telehealth to Increase Healthcare Access for Older Rural Veterans. The study focused on veterans in rural America who are significantly older and more medically complicated than urban veterans. The study showed that access to health services is both feasible and effective by providing specialty geriatric consultation to older rural veterans through telehealth. The study also showed marked effectiveness in the management of complex conditions, timely diagnoses, and reduced transportation costs. Now that you've completed the presentation, please take a moment to pause the video and follow the link below to take the post-test. Thank you for taking time to view my presentation. I hope that you were able to learn something from the information provided. Pictured here is a copy of my references.